Guys, the normal testosterone of a 70-year-old isn't normal for you at 30 or 45. Let me explain how reference ranges are constructed and how they're misleading you and honestly most doctors. When a lab establishes a reference range, they take samples from the population getting tested at that lab. They throw out the top and bottom 2.5% and the remaining 95% becomes normal. Sounds reasonable until you ask who's actually getting their testosterone checked, right? Mostly men who feel terrible, middle-aged guys with fatigue, lower libido, depression, older men with chronic diseases, obese men with metabolic syndrome. The population being sampled is kind of already skewed toward the unhealthy and the elderly. So when the reference ranges come out, like we talked before, 260 to like 950, that's not optimal male testosterone levels. That's the middle 95% of mostly unhealthy men who got tested because something was wrong. A 45-year-old at 280 or 300 is in range. He's also at the level of an 80-year-old. Should that be reassuring? Congratulations, you're at the similar hormone level to Pop Pop. You're normal. Here's what drives me crazy. We don't do this with any other values. If your resting heart rate was 100, technically in range, your doctor would investigate, not just shrug it off. If your blood pressure was 139 over 89, you're technically not hypertensive, but guess what? They'd be talking about lifestyle changes and possibly medications. But testosterone at the 5th percentile, you're fine. What I look at is this in my clinic, right? The number in context of symptoms, age, and goals. A patient with a testosterone of 280 or 350 with classic symptoms in a 45-year-old isn't normal. It's a hormone deficiency that's altering brain function, metabolic symptoms, body composition, and quality of life until proven otherwise. The reference range tells you that you're not a statistical outlier. It doesn't tell you that your levels are appropriate for your age, your activity level, or your goals. There's a difference between not abnormal and optimal. And honestly, for most people, you should be aiming for optimal. The lab doesn't know the difference. Your doctor should. If you've got any questions, hit me up.